Okay, so today we're gonna do the back treatment. So we're gonna check the range of motion first. Yeah, bending forward, flexion. Okay, and then put your hands behind your back and then bending backwards. Okay, good. We're gonna try the PEMF, Pulsed Electromagnetic Field treatment, and then shock wave treatment, and then we're gonna check it again, the result. So Ishai has a little back tightness and then pain on his lower back and the SI joint. So we're gonna apply PEMF treatment. Yeah, this is a water spray. Spray some water, and then put some massage lotion. Yeah. So 0 is the zero intensity, and then 10 is the maximum intensity. When you feel the 6 out of 10, let me know. Okay.
6.
So PEMF therapy can activate the muscle, then also nerve as well. Yeah. Also, PEMF therapy also increase the energy level in the cells, releasing the tightness as well. So cells are keep overusing it, sitting too long, or spending a lot of energy for the activation, contractions, then it depleting the energy. So PEMF can give energy back to the recharging the cell battery. Yeah, so the cell metabolism increases and the healing is getting faster. It has a heating function too, so it heating up. I set up right now to 45 degrees right now. Yeah. Heating function comes from the high frequency stimulation. Yeah, so it makes a little heating effect inside of the muscle. Yeah, as you can see that the muscle is contracting and relaxing. Yeah. As your tolerance increases, less sensitive, I can increase a little more. Yeah. Let me know when you feel like less sensitive. Yeah.
Is less. Can you increase a little?
Yeah, I'm gonna increase a little more. Usually this area, the gluteus medius muscle, this muscle is a very sensitive spot. Yeah. 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 This gluteus medius always being used when you're doing single leg stance, weight bearing on the one side. So this muscle is always sensitive. We gotta release it there. Yeah. This muscle here. Okay, I'm going to other spot. Yeah. So usually the problem area, dysfunctional tissue area, or the circulation is a poor area, where you have a adhesion scar tissue, that area is more sensitive. Yeah. So then we stay over there for a while and hovering around until he feel less sensitive. Yeah. Then that area getting loosened up, then people usually feel less sensitive. Then we can increase the intensity or going to other area stimulation. Yeah, going for other area stimulation. Yeah. You can feel your muscle contracting, right?
Yes.
Contracting, relaxing. Yeah.
Yeah, I feel right there in the glutes.
Also, good thing is not only release, this is also activating the muscle. So yeah, this is helping the exercise and then faster recovery with a better muscle contraction. And this muscle, gluteus medius muscle, is very tight, so he feels a little more sensitivity here. Yeah. Yeah, and activating these electrospinal muscles. Yeah. Over. Yeah.
I can touch.
Yeah. Good. And then bending back and breathe out. Do you feel less tight?
Yes.
Okay, good.